PTSD can affect far more than a person's thoughts. It can impact sleep, mood, relationships, concentration, and the body's ability to feel safe. At Mind and Body Medicine in Dallas, patients whose symptoms have not fully improved with traditional treatment can find a multidisciplinary approach that addresses both emotional and physical well-being.
PTSD, or post-traumatic stress disorder, affects the whole person. It can follow a single traumatic event or repeated trauma over time, leaving patients with intrusive memories, easy startling, nightmares, flashbacks, and feeling cut off from family and friends. In Mind-Body Medicine, we look at PTSD through a holistic approach. Our team includes psychiatry, pain and mind-body specialists, addiction support, and clinicians working together to better understand what is driving the patient's symptoms.
PTSD symptoms can be better managed through the use of ketamine-assisted psychotherapy, or KAP. A KAP session is when a patient and a therapist have a counseling session while the patient is administered a low dose of ketamine.
We're all familiar with what's called fight or flight, when your body mounts a really strong sympathetic response, such that you have heightened arousal, increased heart rate, respiration, nervousness, jitteriness. Well, patients with anxiety disorders and PTSD have that all the time. So one of the things we do is we can actually block or make numb the nerves that supply those very fibers to the head and neck, such that you get a hard boot or reset of the sympathetic nervous system in the brain, thus sharply reducing, and for a long period of time generally, the anxiety one experiences when they're having a crisis or an episode related to their PTSD.
PTSD is also connected to traumatic brain injury, where the effects of trauma can involve both emotional symptoms and changes in how the emotional and nervous system function. In the case of this patient, after experiencing traumatic brain injury, finding care in a facility like DFW Mind and Body that treats both the emotional and nervous system function made dramatic improvements in her way of life.
When I was first diagnosed with CRPS, I went to California for a program. But here we have one right here in Dallas, Texas. I can really tell a difference. I mean, not just about the brain injury, but I had some anxiety from everything and the stress at work, and it reduced my anxiety significantly. I mean, it's life-changing, and I'm really going to miss it whenever I stop going to the program.
There's no single treatment that is best for everyone with PTSD. Our goal is to understand the entire person, then build an evidence-based plan to help restore their quality of life.
They are just warm and caring, and they really care about you as a person.
At Mind and Body Medicine, PTSD care is personalized to the patient with advanced treatment options designed to help calm the nervous system, support emotional regulation, and improve the quality of life.